Motivational speaker Zig Ziglar once said, "What's worse than training your workers and losing them? Not training them and keeping them." Most managers know that training is essential for team success, but many don't take the time to understand team members' individual needs, even though it's the only way to ensure that their people have the skills and the knowledge they need to perform well, plus meet their objectives. Today we present to you upon employee development and healthcare. Current team members for today are presenting are Monica Lozano, Juan Piñon, Guillermo Rodriguez, David Salceda, Chantel Thompson, and Stephanie Zellers. Hello, this is David Salceda. First, I will be discussing analysis of employees when it comes to employee development and healthcare. So one of the first questions that comes to mind when doing an analysis of employees is, how do you know who needs what training, and how do you avoid wasting time and money on unnecessary training activities? My intended review here is just the importance of understanding your employees' developmental needs, and from there looking at a process that can be used to do this effectively. Clearly, some training needs will be universal and will apply to most, if not all, of your team members. However, everyone on your team is unique, and they have different skills, different levels of understanding, and different responsibilities and objectives. Therefore, training and development shouldn't follow a one-size-fits-all approach if you want it to be effective. What I intend to describe here is 6 steps that are adapted from the American Society for Training and Development's Strategic Needs Analysis section. This organization is now known as the Association for Talent Development. When we look at their 6 steps, here, as you can see, I list step 1, which is review team members' job descriptions. When it comes to this, we have to start thinking about what work our team members should be doing, which is usually identified by their job descriptions. We need to identify the skills that they may need to do, the skills that are needed by them to do their things well. Job descriptions can get out of date, so before we think about, start thinking about training, we also need to ensure that we are fairly reflecting what each individual team member actually needs to be doing. Step 2, meeting with team members. Our next step should include meeting one-on-one with each member of the team. The goal here is to have an open talk about the kind of training and development that they think they may need to work effectively and develop their career. They may not feel that they need any training at all, so it's important to be upfront in this discussion, so that you're able to communicate with sensitivity and respect, and perhaps during the process ask the following questions to get a better understanding of your employees' training needs. For example, we may want to ask, what challenges do they face every day? What is the most frustrating part about their role? Or what areas of their role or their organization they wish they knew more about? And perhaps what skills or additional training would help them work more productively or effectively? Talking to them about what they would like to get out of this additional training is very important, helps them find out more about their personal goals, and hopefully perhaps also align their personal goals with the organization's objective. Steps 3 and 4 are a little easier. Step number 3 is observing the team members at work. What we want to do here is kind of do more of an approach of management by walking around. We want to keep an eye on how well team members are actually doing their tasks. For instance, we like to see if they're quicker with their key task or are they just procrastinating on projects. Observation is key here, and that lets you get some data just by observation of how the employees work. Once you've observed the people working, it can also be useful to confirm your assessment by setting specific time-bound tasks that are given to them with the opportunity to just demonstrate their skills and abilities. This also gives you further information. Step 4, gathering additional data. If we approach this data gathering process step in a sensitive way, we can learn a lot from others who work closely with the person that you actually want to assess. These people could be internal or external clients, past bosses, even peers or coworkers. But this is just something we have to be very, very sensitive with, but will give us high yield information. Now we come to our final two steps. Step 5, analyzing and preparing data. Here, we must look at all the information that we gathered in steps 1 through 4. And we must look at the data and see if we saw any trends amongst what we observed or what was reported to us. Have the team members reported any specific skills that they say are needed? Or did we notice upon observation and recording of feedback whether there was any skill gaps amongst the employees? The goal here is to bring together the most relevant information so that we can create a training plan for each member. With that, we go on to step 6, which is determining action steps. With all this, by now we should have a good idea of the training and development that each person on the team needs. The last step is to decide what we're going to do to make it happen. Now, when we look at this, there are several training and development options that we can consider. What we must take into account is that each person will have a different individual learning style, and that we must take this into account before we commit to any one particular training program. Remember that if everyone learns differently, the training will be most effective if we customize it to accommodate everyone's best learning style. Another thing that can be considered here is a cost-benefit analysis to see if the training we're considering is expensive. In order for all these 6 steps to work, though, as mentioned, we must get feedback from our employees, and we must also be allowed to observe our employees, which comes down to an issue of communication. Communication can sometimes be a little difficult between higher management and employees. Sometimes tensions are felt, and thus it is important for us to be able to break down communication barriers. And this leads us to our next part of the presentation.
Hello, this is Juan Piñon, and I'm presenting the Breaking Down Barriers Between Administration and Staff section. Collaboration between departments within an organization is very important to achieve goals of managers and employees as well. The need for an organizational culture in which people efficiently use the available resources, communicate upward and downward the organization for a further understanding of the organization's policies and the role they play on its success, and in which people help each other to improve the overall performance, is even more essential in healthcare practice. Due to the nature of healthcare, there's no room for mistakes. Then, the coordinated collaboration between the administration and the staff must be fostered to lead their efforts towards the same direction. An effective communication is a key element in the process of breaking down barriers between administration and staff. It requires for managers to enable all the possible channels of communication, either oral or written, between them and other employees. Managers should speak openly and honestly with employees about any concern relevant to the performance of the organization, and they should also be willing to listen to the employees' concerns. Likewise, employees should feel free to share their opinion and/or information about issues that may jeopardize the organization's performance without fear of retaliation against themselves. Also, they should be able to listen carefully to their managers. Either way, we must remember that an effective communication is a bidirectional process. This means that both parties, in this case managers and employees, should act as senders and receivers in the communication process. Besides, receiving feedback is a valuable resource to ensure that the message is being understood. It is also important to note that when an ineffective communication between professionals in healthcare exists, it could impact directly or indirectly on the patient's health. In general, good relationships between managers and staff don't happen by chance. They are the result of strategies and activities designed to improve communication between employees and the management of the organization. Besides, the success of the internal communication depends directly on managers and should be planned according to the objectives that they want to achieve, based on the principle that frontline employees, in this case nurses and other health professionals, are the link between patients and the healthcare organization, and therefore their impact is not only valuable but also needed. Some strategies that managers could employ to foster a culture of effective communication are the following: establishing one on one relationships with employees. By increasing personal interactions with employees, managers will be able to know and understand their employees. Therefore, they must meet periodically in a one on one setting, talking face to face. Although written and oral communication is possible, the latter is considered as more effective. It allows managers and employees as well to further understand what's being said, not only through words, but also through nonverbal cues. Besides, it is more likely to receive a timely input through verbal communication than in writing. Creating a team environment. An efficient manager recognizes that every individual within the department is important and valuable. Employees who feel included and appreciated parts of the team will be more satisfied and productive. Finally, please remember, the biggest barrier to effective communication is fear. The only way to fight it is by fostering trust within employees. Everything we get inside the organization in terms of corporate culture will be what is transmitted outside the organization to patients and visitors.
Onboarding new employees. Onboarding refers to the process of integrating new employees into the organization, of preparing them to succeed at their job and to become fully engaged, productive members of the healthcare organization. It includes the initial orientation event and the ensuing months thereafter. Studies have shown that a well-designed onboarding program can turn a new hire into a dedicated employee, reducing the cost of turnover. Getting new employees comfortable, connected, and productive as soon as possible is the manager's role. When managers communicate the big picture, new employees can understand how the roles support the healthcare organization's goals. The availability of resources is very important to new employees. The best managers create a support network for their new hires to help them quickly get up to speed. Managers who are proactive throughout the entire attracting process ensure that the organization has the talent best suited for today and tomorrow's needs. Encouraging new employees. Motivation is influenced by a complex set of social, professional, and economic factors. A healthcare worker will be motivated and express job satisfaction if they feel that they are effective at their jobs and performing well. Factors contributing to motivation and job satisfaction also include strong career development and adequate compensation and adequate working and living conditions. Having strong human resources mechanisms in place within the health system can help to ensure that the right motivational factors are in place at adequate levels to keep health workers satisfied. Motivation strategies should include providing opportunities for career development, make efforts to ensure adequate compensations, and promote positive work environments, including supportive supervision. Knowing that there is room within the health worker's career for further development is a critical factor in motivating health workers. Increasing the number of job opportunities, whether it's moving up the organization hierarchy or provided with the ability to learn new things, is an important indicator of job satisfaction. Retaining new employees. According to the Human Resource Management Association, 20.4% of healthcare employees, that would be 1 in 5, quit their jobs every year. The number easily exceeds the 12 to 15% turnover rate experienced in most other industries. Staff turnovers can be minimized when there is a high level of job satisfaction among staff. Managers are key in retaining their healthcare professionals, as management practices can greatly influence turnover intention. Supervisors must pay attention to staff needs and help create a positive working environment. Managers must look for ways to keep their employees engaged. Hiring and keeping the best healthcare professionals means creating a talent plan to re-energize and refocus your management team. Healthcare organizations must attract and retain qualified clinical professionals to ensure quality care. Healthcare organizations must also source and develop talent carefully, keeping employees engaged and committed while removing underperformers. They must ensure that every manager in the healthcare organization understands the rules of engagement and embrace a leadership role in talent management.
Hi, this is Monica Lozano, and I will be conducting the Employee Development Training portion of Group 5's presentation. Training employees does not only encompass training on the required knowledge to complete the day-to-day operational duties of any employee. Organizations should establish a training program that enhances employee skills and encourages the employee beyond the minimal requirement. There are many benefits of engaging in an employee development training program. Some of the benefits are well-trained employees tend to be more productive. That productivity then leads to a more productive and more efficient organization. Thirdly, employees who feel encouraged to grow are more successful and tend to stay with the organization longer. The following steps may be taken to establish an effective training program. This resource was obtained from www.businessbeat.com. They are as follows. First, identify what the specific objectives of the training program are. This is important because it will determine how you develop the program. Second, identify what training resources you plan to utilize. Thirdly, create a program itinerary to include who will participate, the program schedule with topics to be covered, and the length of the program. You will proceed to appoint program trainers who have the expertise in that particular field. It is wise to offer a briefing meeting to explain what is expected of the program and to clarify employee inquiries. It is also important to monitor the program once the objectives have been completed. Also, it is also wise to obtain employee feedback upon completion of the program to identify the strengths and weaknesses within the program. Lastly, offer continuing education.
Career planning versus succession planning. Career planning is prepping a large range of candidates for a job versus succession planning, which is preparing a single employee to fill a single position whenever it becomes available. So pretty much career planning involves a large mass amount of employees who are trained to do the same task as other employees. Say they become ill or their job, they get terminated for whatever reason and somebody needs to fill that role. It would be very easily filled by a lot of staff members, but it's not something that they currently do or something that they do on a daily basis. So with that said, succession planning is more involved with a large range of or a long time of training and preparation for a single job. So this could involve something like a CEO position where there's a lot more involved as far as responsibility. So there's also going to be a longer time for training. So what people like to do with this is to try to have somebody on staff who can fill the position of the CEO at any time with very little problems and speed bumps occurring with the transition. Career plan. Some benefits of career planning are career planning is used in the humanistic model that has been shown to involve human values and potential growth within the company. And there's a lot of opportunity here for growth and a lot more happiness within the company, less turnover rates, and this creates a higher standard of employees, which in turn reflects upon their environment. So their environment, you could say, rises to the occasion. So the employee's standard is based off their expectation within their environment. Now here's a nice little chart of career planning and the objective of it. So I do think succession planning and career planning have their differences, but they also do have a similar goal. They are parallel to each other with the same goal in mind, and here's how the objective of career planning helps lead to succession planning. It attracts and retrains talent by offering better career growth. The use of HR effectively and achieve greater productivity, reduce employee turnover. It improves morale and motivation, which then eventually leads to better succession planning. Succession planning being something that takes a lot longer than career planning. Succession planning, as I stated earlier, could be involved with the CEO leaving the company, and this isn't something that just can be easily replaced. Succession planning also should not, may I add, only be for CEO positions. It could be in general a good idea or a better idea than just replacing somebody. But this is what career planning helps. It keeps people happy and with the idea that they will grow within the company. There is a chance to grow. This keeps the employees within the company working very hard so that they can also one day maybe become the CEO of the company. So this is a great way for the company to keep the morale, the reduced employee turnover, as we stated, and it just in total is just a much better management process. Now here's
Succession planning. Succession planning is a significant matter for any organization, and while we focus on the healthcare setting, the points made can be applied to all organizations in all settings. Succession planning is an organized human resources process that sets the stage for a strong leadership transition. It involves identifying and preparing a successor for the CEO. The process is conducted while a CEO is in that position. Organizations should produce succession plans for their CEOs prior to moving on to other senior managers. Succession plans for middle managers are often more precisely defined by the term career planning. The main difference between succession planning and career planning is the focus, where succession planning comprises preparing a single designated successor. Career planning comprises preparing several candidates for a particular position. Succession planning should not be limited to the CEO. Succession planning can be used in a larger sense and include other positions and be more detailed than simply retaining it for the CEO role. Changes in leadership at the top of any organization will certainly cause great stress and uncertainty among employees and members of their governing boards. In situations where a successor is not immediately apparent, nervousness is deepened and may negatively affect structural functioning. So organizations with top-level succession plans have a better chance at experiencing smoother leadership transitions. Organizations without succession plans are really leaving the growth of their future leaders to chance instead of thoroughly recognizing and preparing a high potential individual to carry on and deliver the needed leadership. Healthcare organizations specifically may benefit more from effective succession planning than other types of businesses. They are strangely complex and have been known to raise highly political atmospheres. Consequently, extensive time and effort may be needed for outside persons to comprehend and learn how to steer and lead them. Succession planning. Succession planning is a significant matter for any organization, and while we focus on the healthcare setting, the points made can be applied to all organizations in all settings. Succession planning is an organized human resources process that sets the stage for a strong leadership transition. It involves identifying and preparing a successor for the CEO. The process is conducted while a CEO is in that position. Organizations should produce succession plans for their CEO. 5 principles of CEO succession planning. CEO succession planning should be a board-driven, united process. Therefore, one of the governing board's 2 or 3 most significant responsibilities as it seeks to ensure a strong and viable organization. Selecting a successor must be a collaborative effort that includes the current CEO, but it is fundamental that the governing board has final accountability. The governing board and CEO should communicate openly about the process. Any agreement or promises the board makes must be conversed to the succeeding board leadership. CEO succession planning must be a continuous process. A CEO can leave unexpectedly at any time. Up to 9 months may be required to recruit an outside replacement, and at all times a successor should be readily available. Key leadership measures and competencies must be defined for any possible successor. Potential successors with the proper skill set and talent should be identified as early as possible in their careers. By finding a potential successor for the CEO role, substantial developmental assignments can be arranged to guarantee that suitable experiences are encountered. The objective of CEO succession planning is to bring the right leader in at the right time. Specific objectives and succession timelines should be formed and monitored. Human resources departments have an imperative role in paying attention to certify that planning is comprehensive and the assignment process is complete. Once the transition has taken place, a post-succession evaluation should be conducted to assess the results of the process. The Human Resources Department should evaluate the overall success of the program to produce an understanding of what worked and what didn't. Why organizations do not create succession plans. The task is overridden by more immediate and pressing issues. Ironically, if a CEO departs suddenly, the most pressing issue for the governing board becomes planning for a new CEO. Lack of experience with the process and their lack of knowledge of how it could benefit the organization is another reason. Also, some feel in implementing such a plan, the governing board or boards is somehow hastening a CEO's departure. Some CEOs fear that they will lose control and influence and become lame duck leaders once the succession plan is adopted. This perception is intensified if the succession plan designates the next leader. This converts a succession plan into practice by grooming. Some CEOs have stated that they feel as if they are planning their own funerals. Governing boards, for their part, may not want to talk about succession planning because they do not want to imply that they have lost confidence in their CEO. In these cases, CEOs and governing boards must recognize that while succession planning and implementation can be difficult and awkward, it should be considered a crucial goal that is imperative for the continued success of their organization. Some organizations elect to evade succession planning because their governing boards consider that, regardless of the obtainable inside talent, an outside person should be enlisted to replace the CEO. However, relying on replacing an outgoing CEO with an outside person can be dangerous. The CEO is a prominent structural position, and the more visible a position is, the harder it is to locate and recruit a fitting candidate. Many of the barriers to succession planning are collected of self-imposed fears and apprehensions. However, these can easily be overcome if a CEO or governing board truly wants to develop a program. Why organizations